So with the greetings, we would like to discuss about more on the Rasoushadhies in routine clinical practice, and specifically to raise the questions on frequently asked questions. So based on this classroom teaching of Rasa Chikitsa, wherein we have a series of disorders which can be covered on the various grounds. Of course, few of them I did covered in many of the sessions or presentations previously with you people. But one such thing which we have already discussed very recently is about the infertility. So now we will be discussing more on some grave disorder as well, because many people have this question. So I encountered it on the concept of frequently asked question. Is it really a fact that Rasoushadhies can also be given in some grave disorders where the person is critically ill? Can you manage certain conditions wherein you have the patient suffering from a very terrible disorder where you have the Bahudoshavastha, or where you have the multiple involvement of various shrotasas, where you have more than one samprapti ghatakas being involved, or more than one type of pathogenesis which has been involved, like you have usually with that of Sangha, Vimarga Gamana, Atipravritti, anything of those kinds. So if you have any such pathologies, then the treatment becomes very challenging. And to get your notice on this particular aspect, Rasoushadhi is a choice of drug for most of such disorders, because it is one such a drug which acts on a multifaceted and multidimensional view, and it is very much beneficial. I give only one drug, it acts on multiple systems. I give only one drug, it shows its efficacy at various levels of the body. It shows its efficacy at various sampraptis. So based on these grounds, I try to choose upon the Rasoushadhies right choice of drug for some of the grave disorders. So one such a disorder which I will be discussing today is about the malignancies. So we'll try to discuss few points about the patients suffering from cancer, and what about the metals and minerals which we would like to prescribe in those patients who are suffering from cancer or malignancies. What are the stages? I'll not be dealing about the pathological process of malignancy, what happens there and all, and I'll not be dealing in detail about what are the medicines which we are usually prescribing in malignancies. It is just a gist of the presentation where we'll be presenting something like the Rasoushadhies can be given in malignancies as per the grounds of the textbooks, and also based on some of the clinical experiences. So many of such things can be categorized, because many times it has been observed clinically, patient comes to you with that of a cancer pathology. Many times it is in the tag end stage, where the person is in the upadrava state, almost a patient with a arishta lakshana many times. So you have those people where they already opted for the other modalities of treatment. They would have adopted some surgical treatment, some other system of medicine, or they would have adopted for chemotherapy like treatments, radiations, whatnot. So after that, in case if the patient did not find any response, then they come in search of the avenues wherein they find a good response with the Rasoushadhies. So they have been tagged to take the Ayurvedic management. So based on these particular grounds being referred to the Rasa department, I would like to say it is a right choice for the patient. For sure to say about, it's not like we are able to cure all the cases of malignancies of all stages. Definitely no. Neither of the systems on earth will claim their possessiveness towards the high percentile of treating malignancies. It is always a risk involved, and always a patient is under alarmed situation, and he will be always need extra caution to set in to see about what should be his response whenever he goes with the management of patients. Whenever he has the reports being arrived stating like it is a malignant condition, atypical presentation of the cells in a particular biopsy or any of the blood investigations where he finds it is really illogical in a physiological process. then he is being tagged or named as malignancy, wherein they have put up their avenues as Rasoushadhies. And what can we try to do for such patients, and especially at a OPD level, where the patient is not being possibly admitted. He comes at a OPD basis, take the treatment and goes away. He takes relaxation at his home and try to maintain the things on his own. So what are the things what we can frame based on the Rasoushadhies in such clinical conditions wherein you have the malignancy like presentations? अल्पमात्रस्य उपयोगित्वात् अरुचेर अप्रसंगत्वात् क्षिप्रम आरोग्यदायित्वात् औषधेभ्यो अधिको रसः. I'll say this is a mantra for all the rasa practitioners. You should keep this as a very, very sacred chant, just because of the reason it explains the possibilities or the success rates of the Rasoushadhies in most of such conditions. It is not an exaggeration wherein the textbook has praised so much about the Rasoushadhies. It has been claimed to this extent because there are certain extensive drugs which acts on kshipram arogyadayitvat. See, whenever you have a patient with that of malignancy, he is with a Bhaudoshavastha most of the times. He is in a deep-rooted illness, he is in a chronic condition. He has already adopted many of the treatment modalities, but it was unsuccessful, so he has been chosen to come over to the Rasoushadhi or a Rasavaidya for his treatment conditions. So you have the drugs like that of the Potali Kalpanas, you have the Basmas, you have many of the Rasoushadhis which acts as claimed by our acharyas as a kshipram arogyadayitvat. The patient did not find response. Many times we can observe such kinds of patients in the clinical practice, wherein the person is diagnosed as malignant since years, and due to some reason is not being addressed well. He has been adopted with surgery, he has been adopted with chemotherapy for so many times. Many times we find it has been, all the doors from all systems has been closed, stating like nothing more could be done. So even in those conditions, by administering Rasoushadhies, a positive response was being observed in the clinical practice. So on these grounds, what are those positive avenues? One thing is, in case if you can really cure the malignant patient, that's a bonus, that's a bliss for the treatment modalities. The second thing is, in case if you can postpone the milestones of the illness, is it possible to postpone the milestones? The patient with possibly a breast cancer is having an expectation of 5 years. Possibly the mortality is approximately 5 years. So is it possible something like we can postpone the event to 10 years or 15 years or something, elaborating it? The third modality is something like, can we give them a better life? The patient is crippled on the bed by taking so much of medicines and also with their side effects. So is it possible by giving any of our medicines, the patient is able to move around, the patient is having a normal life? It's not a cure, but he's having a quality of life there. So are we able to succeed in this aspect? So all these things turns out to be the rich avenues for the Rasoushadhi practice. Can we really make, to what extent it is possible? Like others, yes, even we don't claim or we don't assure the patient with a 100% success rate in treating malignancies, but still you do have lots and lots of benefits by administering Rasoushadhies. Many of the patients are being possibly very well cured with no side effects. Many of the patients have got a tremendous improvement in the quality of life. The postponement of the milestones of the illness was significantly achieved. So on these grounds, it is always advised, you have some of the most sacred preparations in the Rasoushadhies, like you have as that of the Potali Kalpas. You can see the drugs like Hemagarbha Potali, Vishagarbha Potali, Tamragarbha Potali, Ratnagarbha Potali, Sarveshwara Parpati. All these are the various drugs which are available for us for maintaining the patients in such exclusive way in all such a graveful conditions. So because of those conditions, we are able to treat the patient in a significantly better way. So with this avenues, we will try to see what we can try to understand on the grounds of malignancies and what about the Rasoushadhies being taken in it. There are few of the malignancies which are having grossly taken as adenocarcinomas, where they are in the form of a cauliflower-like growth most of the times. And here in these conditions, it is usually the spread is very fast, and most of the times it is almost like vataja or something like vatapittaja. And in these conditions, we need the drugs very specific as that of swarna, tamra, and tridhatu. Sometimes definitely yes, we might need some other corrosive drugs or very strong drugs like that of Gauri Pashana, Haratala, Manashila and all, wherein we can arrest the condition very significantly. When I speak of this combination, I would like to get it to your notice the beauty of Rasashastra. What is the beauty of Rasashastra there? These drugs are highly toxic and corrosive. Like you have copper, like you have arsenic, like you have mercury. So these are few of the drugs which are really very toxic, really very corrosive, and really very boonful. Why did I use the term boonful? When you refer to the textbook of Rasashastra, the Acharya has explained us the Ojo Vardhana. What are the Ojo Vardhana like that of drugs? Ojo Vardhana drugs are the one which can increase the ojas, and most of the times in malignant patients, you find the ojas is being lost. The Ojo Kshaya is being observed. So whenever you have the patient with the Ojo Rasa or Ojo Kshaya, we are supposed to prescribe him with that of the drugs like of these kinds, wherein you can really have a very good improvement in the patient's condition, wherein you have a Ojo Vardhana along with a sort of a Lekhana property, along with that it is Vatahara, along with that it is Rasayana, also it is having a Sarvadhatu Kara. It is going to enrich the nourishment, it is going to do the Lekhana, it is going to do the Ojo Vardhana property, it is going to attain the Dhatu Sarata. So this mixed combination where you have many times a real boon for us. How can a drug of such varied features, such complex features can be achieved in a single protocol? So those drugs can be tried up in most of these countries. Sometimes it happens like the patient is been suffering from other conditions like that of squamous cell carcinoma. So whenever you have such conditions with squamous cell carcinoma, it is most of the times it is taken possibly as a kaphaja because the metastasis is quite low here in these conditions like squamous cell carcinoma. And most of the times they do respond to the Lekhana Chikitsa or the drugs which can act on the kapha there. Again you have the same choice of drugs like that of copper, Tamra Basma, which can be given. My choice could be something like Tamra Garbha Potali to them, Hema Garbha Potali again. I give the local applications as well. I give these potalis in the form of a local application on the wounds, ulcers and area where the malignancies are being observed, just to have a local effect as well. So by application with the local, with that of the basmas, it happens like the local tissue gets sloughed out because of this corrosiveness, but it's not going to harm the healthy tissue because it is Ojo Vardhaka. So you need such a drug, because many times it happens like there are a set of drugs which is really not Ojo Vardhaka, but they are going to kill all the cells including the healthy cells. It is usually observed in many of the treatment modalities, but it's not so with that of the Rasoushadhies. Rasoushadhies kill the abnormal cell and restore the normal cell because they are Ojo's Kara. And also drugs like Swarna or Medhya. Why you need Medhya drugs here? You need Medhya drugs just because of the reason the cells have lost its capacity of identifying its own tissues, and it's started without its pragna. It is starting to multiplicate, and it is multiplying in such a way like it is turning abnormal, and it is unable to control the condition. So many times we have observed the cases wherein the people had some malignancies of the abdomen, malignancies of elsewhere where it was necrotizing type, where is no Jiva Tattva there. But then even in such conditions, by administering the drug like that of Hemagarbha, the necrosis like conditions are being reversed. As it is being seen before and after treatment with the PET scan or CT scan or anything like that, the necrosis of that particular tissue in particular way of the body is being totally arrested. It is totally within limits. So on that grounds, it has been very significantly observed to have the benefits of treatment modalities with our drugs. So a high salute to the drugs like that of Hemagarbha, where it can be usually been observed in most of these conditions. And administering these drugs will have a great benefit just because of the reason they are complex molecules. What you have done in most of the Potali Kalpanas is you have taken particular drugs. So they say, for example, you have taken Rasasindura, you have taken Thalasindura, you have taken Tamrasindura, then you have processed it along with the Parada and Gandhaka, again you have mixed with Swarnavasma, and again you have processed in the form of a Potali preparation. So by this it happens like it's a very complex mixture which are being reprocessed for multiple times being a Gandhaka Jarana. Say for example, I want to prepare Tamragarbha Potali. I have already prepared it with Tamra Basma, wherein I have processed Tamra with Gandhaka for almost 30 times, 40 times or 50 times, because for the Putta Nirmana, wherever we are giving the temperature in the form of Putta for the Basma Nirmana. So once they have achieved to this extent, there is so much of Gandhaka Jarana. More and more of Gandhaka Jarana, deeper will be the penetration of the drug. Why? That is what the concept of Jarana in Ayurveda is being explained from. So this particular thing is going to show its benefit in the patient by which it has a deeper penetration. And added to that, most of the drugs like as you see with that of Swarna, with that of Parada, with that of many drugs which are something like Vaikranta, which are something like other drugs, wherein you find an exclusive Tridosha Shamaka property. And still, in case it happens like sometimes the drugs which you have chosen from that of the Rasa index is not a Tridosha Shamaka, you tag them with that of the drugs which can act on Tridoshas. Say for example, in most of the malignant cases, I try to give to the patient with that of the Potalis or Basmas, whatever it is, with some drug which acts on Tridosha conditions. So in case if I can take it as Gulma pathology, Varanadikwata is one such a drug which is very suitable for Tridoshaja condition. So here for the Tridoshaja condition, I do give this Potalis with Anupana as Varanadikwata, by which it happens like the person will have a Tridosha efficacy of a particular drug because you have tagged it with that of Varanadikwata. Always the Rasoushadhies do have their inbuilt qualities, but it can be diverted, it can be made into a different biological molecule by tagging it with various Anupanas, changing its clinical modalities. So whenever you would like to change the clinical modality of any of the drugs which is there in the Rasa index, try to tag it with a certain herbal media which can really act upon in a different direction. Then the Rasoushadhi also will have its efficacy in that particular way. So this is the fancy of Anupana. You can have a discussion of nearly 2 or 3 hours only on the concept of Anupana, and more specifically Anupana and its significance with that of Rasoushadhies. It's a very important part of the treatment modalities. I don't believe in the treatment modalities where Anupana is not suggested, because the treatment is incomplete in case if you are unable to tag your prescriptions with any suitable Anupanam. Anupanam is an essential component by which it can definitely have its efficacy of treating the patients, and especially with that of such a Tridoshaja condition, Sannipataja conditions. Most of the times by the time the patient comes to you, the patient is already having his complication stages. The patient is already been suffered from various illnesses. The patient has been having the complications with a multiple Srotas level where he is almost in a stage of Upadravavastha or Arishta Lakshana. So recently I would like to say I had a patient wherein he had hemoptysis. So for that particular patient we have started with that of why hemoptysis? Possibly because the scan reports have suggested like there was a malignancy in the chest, a malignant lesion in the chest, especially in the lungs, and because of the size of the malignant growth was being significantly rising, there is a rupture of the blood vessels surrounding and there is a hemoptysis observed clinically. So for that particular patient we have started with that of the Hemagarbha, we have started with that of Pravala Garbha, we have given him with Sarveshwara Parpati, we have given him with Anupanam as Varanadikwata and also Panchavalkalakwata for Ropanartha. So by that we could establish a wonderful response. The patient almost had no complaint of hemoptysis after 4 or 5 days. So within the short period, hemoptysis was totally been arrested. Hemoptysis was totally been arrested. So we have many such cases wherein the patient is in combination with that of the chemotherapy. He says, sir, I am happy to take both the treatments together. You have another set of people of these kinds, wherein the patient will say, sir, I'm not ready to, because my family members are due to some pressure, I'm not ready to take any chance with that of the patient's life. So I would like to take the chemotherapy along with the Rasoushadhies. I say, okay, fine. Only thing is, in case if the patient is on chemotherapy or radiation, I would like to add up Pravalagarba Puttali or any of the drugs like that of Pitta Shamana, because many times I observe a sort of a hot flushes and a sort of a irritability in the patient because of the treatment. So I would like to add up the Pravala preparations there. Or else, most of the times the drugs like Hemagarba, Vishagarba, Talagarba, Malagarba, Rasagarba, Tridhatugarba are real boons to be practiced in these conditions. Tamragarba is one more drug whenever you find some conditions with that of Vata Kaphaja in nature, especially where you find specifically in adenocarcinomas or conditions like that. Tamragarba is really a boon of a drug which can be given for those conditions. Fortunately or unfortunately, it happens like certain patients we are unable to disconnect them from that of chemotherapy. I never ask them, you don't take a particular treatment modality. I give them to their choice. I'll explain the in and outs to my level of knowledge, and I'll ask them, you can consult to your respective doctors wherever you find them as a specialist, and try to see if at all you need any of those medical supports in case. Eventually it happens like the number of chemotherapy given to the patient eventually would have come down. Eventually it can come down, and the patient is only on the Ayurvedic medicines and is quite happy with the treatment modalities, because none of these things are really having that stressful thing. None of them will have a debility in the patient. None will exhibit something like Bhala Rasa in an individual. None of them will cause any discomfort or side effects to the patient, provided you prepare the medicine in a proper way, you administer it in a rightful way, and try to see that in case if you can manage the things in a fine, extensive way. Only thing which I do is I try to reassess myself by repeated investigating the patient. Might be it's a cancer marker, might be it's a PET scan, repeat PET scan, might be it a CT abdomen or CT of that particular area affected, or reassessment might be for every 3 months or 4 months or 6 months. To the extent possible, we'll try to analyze the patient and try to maintain him. Very basic thing which I have observed in most of the malignant patients is the bala will never come down most of the times. The patient always finds he is having a sort of well-being, his strength is very well maintained, and he finds a sort of a total normalcy. Very few are the conditions wherein we find the patient is really sick and deteriorated. So these are few of the general guidelines for the malignant patients, wherein it can be managed with that of the Rasoushadhies, and it can be maintained with the patients to the best possible way, to the extent possible with the avenues available in the present situation. By having more and more choices of drugs, by having more and more availability of a rightful drug, we can make more miracles with this particular science. Thank you very much.